So our next speaker is Dr. Tudimol Devasia, who will be talking on the role of intravitreal ganciclovir therapy in cytomegalovirus retinitis.
Good morning all. Today I'll be talking about role of intravitreal ganciclovir therapy in cytomegalovirus retinitis. CMV retinitis is a frequent cause of opportunistic ocular infection in immunocompromised individuals, progressing to blindness in the absence of early intervention. With the development of potent antiretroviral chemotherapeutic agents, there is decrease in the incidence of CMV retinitis, decrease in the viral load, improvement in CD4 T cell counts, and reduced mortality. And the 4 medications approved by the FDA for the treatment of CMV retinitis are ganciclovir, valganciclovir, cidofovir, and foscarnet. And all these agents are virostatic. In our study is a non-randomized retrospective interventional series consisting of a consecutive cohort of 7 ISO5 patients with CMV retinitis who received intravitreal injection of ganciclovir on a bi-weekly basis for 3 weeks as induction regimen, followed by oral valganciclovir and heart therapy. This is our first patient who presented with the indolent SON1 CMV retinitis with a vision of 660, and her left eye was PL negative with a chronic RD. After 6 doses of intravitreal ganciclovir, we can see that there's a good resolution of lesion, and she was put on maintenance therapy. But there was poor compliance with the oral medication, and there was reactivation and retinal detachment, and she underwent vitrectomy and silicone oil tamponade. 3 months after vitrectomy, we can see there is a well-attached retina and good resolution of lesions. And this is patient number 2 who presented with both eyes SON1 CMV retinitis. And this patient also received 6 doses of intravitreal ganciclovir, and we can see good resolution of lesions. Totally, we gave 40 injections, and all the patients did good in the induction phase. And one eye developed reactivation and recombinous retinal detachment during maintenance phase because of poor compliance and needed vitrectomy. Though all the patients stabilized, there was decreased final visual acuity because of the retinal atrophy in the healing phase. Ganciclovir is a virostatic drug which interferes with the DNA polymerase, resulting in inhibition of viral replication. FDA-approved routes of administration are intravenous ganciclovir and intraocular implants. These routes are expensive and may not be appropriate for low or middle-income countries. Intravitreal injection of ganciclovir is easy, safe, and cost-effective, and provides fast and high intraocular drug concentrations. The reported dose ranges from 0.2 to 6 milligram. It is typically used for SON1 CMV retinitis as induction regimen of twice weekly injections, followed by maintenance regimen of oral or intravitreal ganciclovir. In this case series, a total of 40 injections were given in induction regimen with a good resolution of CMV retinitis. There was no case of endophthalmitis. On follow-up, one patient developed reactivation and retinal detachment due to poor compliance with the oral medication. Though there was disease stabilization, there was decrease in visual acuity secondary to macular atrophy in healing phase. To conclude, intravitreal ganciclovir in the maintenance phase has the advantage of being cost-effective, targeted to eye with minimal systemic side effects, rapid and longer acting, thus increasing patient compliance. And there is need to explore intravitreal therapy as means of sustainable maintenance regimen, especially in developing countries where cost-effective treatment is the need of the hour. Thank you.
What was the dose that you used in your study?
2 milligram and 0.1 ml, ma'am.
2 milligram. And how do you decide the end point? When do you stop giving the injections? Did you follow a set regime like you just gave 6?
The induction phase, bi-weekly injections for 3 weeks, ma'am, followed by in the maintenance phase, weekly 1 injections. Mm-hmm. And when to stop therapy is when the disease is stable without any activity, and the patient, if the immunocompromised patient should be on heart therapy and CD4 count more than 150. Yeah. And this should maintain for 3 to 6 months.
So in that patient who had reactivation, do you think giving more injections would have prevented?
This set of patients, this group of patients did not receive injection ganciclovir in the maintenance phase. We gave oral valganciclovir, which is very costly. And these patients, because they come from a poor background, they don't take the tablets, and they have a recurrence, reactivation. Now we have a group of patients who are receiving maintenance dose of injection only, not oral vial ganciclovir, and they are sticking to it and they are having good remission.
These two cases you showed, both are HIV positive?
Yes, all of them are HIV